Well, good afternoon, everyone, and welcome. We're so glad you are joining us today. As I shared at the top of the meeting, this is an information session for the Thriving Providers Project request for proposals. Sorry, that's a mouthful. For implementation partner of TPP in Los Angeles County. We are excited to be hosting this information session and request for proposal about the request for proposals. We are doing this in conjunction with First 5 LA County. And so we're excited to be able to tell you a little bit more about this opportunity and to share with you information about the Thriving Providers Project. I'll just go a little bit through our agenda for today and let me advance our slides here. So we'll do a little bit of an overview about the project, and then we'll go into the RFP itself. We'll talk about the qualifications for the implementation partner. We'll also talk about project values and agreements. We'll review the scope of work for both the planning and implementation phase. We will talk about the technical aspects as it relates to submitting a proposal. We'll share some of the evaluation criteria, and then we'll have a section of our agenda that's focused on questions and answers, and then a review of the proposal timeline. So we'll try to move through this agenda as efficiently as possible and get you out of here on time. Just to share a little bit about Homegrown itself, for those of you who may not be familiar with Homegrown, Homegrown is a funders collaborative that publicly launched in 2019. And our investment priorities are focused on home-based childcare. Our work is inclusive of both regulation exempt or unregulated family, friend, and neighbor caregivers and licensed family childcare. And I know that often in our community, there's an acronym soup. And so when we use terms like family, friend, and neighbor, or FFN, it's helpful to go through what we mean by that term. And so when we talk about family, friend, and neighbor caregivers, we're talking about a large group of caregivers in this country who are typically caring for children with whom they have a previous relationship. They're often doing this in their own homes. They may hold the role of grandmother or auntie, abuelita, or a neighbor. And in many states, they're allowed to deliver this care while being legally licensed, exempt, or non-licensed, meaning they're not required to pursue licensure to serve usually a small number of children.
Alexandra, I'm sorry to interrupt, but it sounds like a few participants are not able to see the slides being shared. Would you mind maybe trying stop sharing and restarting just to see if that helps reset it?
Absolutely. Thank you, Claire. Let me click back here. So here's the agenda for our session. And I'll pause so you'll have a chance to see it.
At the moment, I don't see slides either. I was seeing them previously.
Let's try that one more time. Let's see here. I wonder if Claire, maybe you could share the slides. I'm not seeing the option to
I'm happy to share them. Just give me 1 second while I get it started here. All right, I'm going to share.
Okay, awesome. Okay, I can see your slides, so I don't know.
Okay, does that work for everyone else?
Okay, I'm seeing thumbs up. That's a good sign. And just a quick reminder to you all, thank you, Claire, for bringing my attention to that. If folks have questions, please do feel free to drop them in the chat box. We do have folks who are monitoring the chat box to be able to respond to your questions before we get to that Q&A section as much as possible. So if anything is a challenge, please make sure that you utilize the chat box and let us know. So here's the agenda. We kind of talked through the outline that we'll be using for today. And then Claire, we could maybe just skip forward to the definition slide so folks have a moment to look at that. Wonderful. Okay, well, let's go on to the actual project background and guiding assumptions. So the Thriving Providers Project is an outgrowth of Homegrown's delivery of emergency funding in partnership with local community-based organizations during the pandemic. So we know how difficult the pandemic was for most of the childcare sector, and it was particularly felt in the home-based childcare community and for family, friend, and neighbor caregivers. Many states were delivering financial relief to early childhood caregivers, but often home-based caregivers were either unable to access those resources because of a process or a policy barrier. And so during the pandemic, Homegrown worked with local partners to deploy emergency relief dollars, both public and private in nature, to home-based caregivers, and in particular to FFN caregivers. However, doing this work really created a clear picture of the material hardship that home-based caregivers were experiencing. Simultaneously, the Rapid EC team, formerly at the University of Oregon and now at Stanford University, produced a series of briefs depicting the bleak experience of material hardship for early childhood workers, home-based providers, and FFN caregivers. And these findings also pointed to the impact of this material hardship on caregiver well-being. And so really from those two bodies of work, the Thriving Providers Project was launched. And it really is based on several key assumptions that providers are committed, they're creative, they're entrepreneurial, rational, and really should design and be in a role of accountability of services and policies that are seeking to serve them. Parent decisions reflect their values and needs, and they should be able to access high quality services in various settings, including FFN and family childcare settings. Home-based childcare is intersectional, and by its very nature, solutions and investments must be multi-systemic. The pandemic really helped us to understand the deep inequity of the underinvestment and disregard for providers and families in home-based childcare. And in partnership with the home-based childcare community, we can catalyze and build durable infrastructure that will support providers and families and help them to thrive. And then finally, that economic well-being and stability must be the foundation for growth and success. On this next slide, you'll see just a little bit about what we know about FFN caregivers in our country. So over 5 million FFN caregivers look after 11.5 million children in our country and 6.8 million
Yeah,
children.
here comes the next one. Perfect. Thank you. I know you're gonna-
And that includes 6.8 million children who are 0 to 5. 30% of our infants and toddlers are in home-based care. And often home-based caregivers are caring for families who are furthest from resources and often underserved by the early childhood community. So that might be families in rural communities who might have limited resources or be low income, those families who speak multiple languages, have children with special needs, or might need care during non-traditional hours, or identify as Black or Latin. And when families are asked about why they're choosing home-based care, they often say that they're doing that because they trust the caregiver, there's a cultural or linguistic match, that the caregivers are willing to be adaptable and accessible for their family's unique and changing needs, and that there is affordability as well. When we think about why guaranteed income might be a solution for the home-based caregiver, population and ensuring that they're adequately resourced to continue doing their caregiving work. We know home-based caregivers are the lowest compensated caregivers in our country. They're working full-time, but they often live in poverty. They're many times excluded from ECE system resources, as well as broader supports for um, broader economic supports. Many home-based caregivers rely on second jobs. And as I shared earlier, what we are learning from the rapid EC studies is that many of them are experiencing material hardship that has the potential to impact their ability to show up as a responsive caregiver. And so despite the value that they're offering to families and communities, we know that home-based caregivers are under-resourced for the work that they're doing. And this quote is from one of the caregivers who was able to participate in the Thriving Providers Project in Colorado. Caregivers sometimes pay for extra food or medicine for the children of low-income families that they serve, but we don't hold back any care from the families we serve to take care of ourselves. And that quote can be found in Yes Magazine article, which is linked to the slides, and we will make these slides available after the session. So if we go to the next slide, we'll tell you a little bit about the Thriving Providers Project itself. The Thriving Providers Project, affectionately known as TPP, is a demonstration project that uses guaranteed income strategies with home-based caregivers to inform policy reforms around early childhood payment systems and compensation approaches. We do this work in collaboration with regional partners, and in our initiative, we are able to both design pilots that support FFN caregivers and family child care providers. Although this LA County cohort, we are seeking to serve FFN caregivers. The intent of TPP is that the project outcomes will really inform a policy approach that reforms how payments are made for care work. And that includes some of our federal funding sources that are allocated for childcare, but also other funding sources that might be able to be leveraged to childcare workers. So that's a little bit about TPP. We'll go into a little bit about the national project approach. So at Homegrown, as for local communities, one of the things that we are able to do is leverage project resources to local communities to create some efficiency around implementing a guaranteed income pilot that's focused on home-based caregivers. And we're thrilled to be co-funding this project with First 5 LA. And as part of the TPP replication community, local partners are able to access a menu of resources, including startup and implementation funds, a replication toolkit to support community-based, provider-informed pilot design, a payment platform, a peer learning community, as well as expert TA to support policy, action, and evaluation of the pilot. On this next slide, you'll see the theory of impact for TPP. We've developed this theory of impact in collaboration with Stanford University. And it really helps us to both monitor consistency of strategies across all of our pilot communities, but then to measure both progress towards targets and outcomes across communities. The theory of impact helps us examine our learning agenda, and those items on our learning agenda include: to what extent do direct cash transfers affect the economic stability of providers? How might economic stability affect access to care, continuity of care, strengthen caregiver relationships with children, and improve provider well-being? Which payment approaches and structures stabilize the economic well-being of caregivers? How can we reform childcare payment policies to ensure the economic well-being of caregivers? And we're excited that we're already seeing promising outcomes from the 12-month findings of our Colorado cohorts. And we're expecting soon to have data from the 18-month findings from Colorado. And so as we move into each replication community, we take this same theory of impact, include some local contextual information to design in collaboration with the community, as well as Stanford, the local evaluation plan. The intent of TPP is that the direct cash is delivered as part of a set of services that are complementary to existing programs that may already be offered to providers in that community, that the cash is delivered with no strings attached, and giving power and agency to providers to make decisions for themselves about how best to use the resources, and then that the cash is both reliably and consistently delivered with few barriers to access. On this next slide, you'll see a little bit about our current TPP communities, and you'll see we've added California there, and we're excited about that. We're also doing work, as I mentioned, in Colorado. We are partnering with the team in King County, Washington as learning partners of the project, and then we have implementation sites in Pennsylvania as well as New York. On the next slide, you'll see our project consultants and TA partners. In your RFP document, there's a little bit more of a description about all of the supports that are available to implementation communities who participate in the Thriving Provider Project, but these are our consultant and TA partners who support implementation of the project. So Stanford, as I mentioned, is our evaluation partner. Beam is our payment platform. The Urban Institute supports some of our policy work with local communities. Impact Charitable was our Vanguard implementation site and continues to support us in helping other replication communities learn from guaranteed income best practice. We have benefits education consultants, Kimberly Drew and Jennifer Kellett. We also have a national project advisory, and we continue to engage provider advisors and informants throughout the project. On this next slide, you'll see a little bit about our project team, and I'm just remembering with all the logistics at the top, I didn't introduce myself. So my name's Alexandra. I'm the Director of Policy and Strategy with Homegrown, and so excited that some of our other team members are joining us on the call, Joycelyn Felix, Lisa Conley, and Danny Glover. And my colleague Claire, who's not featured on this slide, and is also helping us to get the project in LA off the ground. And she'll share a little bit with you about the actual project logistics and how to submit a proposal. All right, so we're going to move into our next section here, and this is really where we're going to talk about LA implementation of the Thriving Providers Project. And so on the next slide, we'll just tell you a little bit more about the LA project. As I mentioned, we are co-funding this project in partnership with the Los Angeles County Children and Families First, Proposition 10 Commission, First 5 LA. And we are looking for proposals from organizations who are interested in being the implementation partner for the Thriving Providers Project in Los Angeles County. So this proposal seeks to identify an organization to lead the planning and implementation process for TPP LA. The theory of impact you saw really outlines all of the values, core strategies, targets, and outcomes, and ensures that those are consistent across communities. However, there is a portion of implementation in each local community that really is essential to be developed and designed in community. And so the implementation partner really leads that process of design in community and ensures that TPP implementation locally is relevant and really responsive to the needs of the landscape. So the identified CBO partner will co-facilitate a community-led design process during the planning phase of TPP-LA in order to scope the implementation methods for the local pilot. TPP-LA will provide regular, unconditional, unrestricted cash transfers specifically to FFN. So as I mentioned, this is an FFN cohort caring for children birth to 5 years old over the course of 12 to 24 months. And the cash transfers are designed to be additive in nature and are intended to be delivered alongside an existing or new program for home-based caregivers offered by the implementing CBO. On this next slide, you'll see what we're looking for as it relates to implementation partner qualifications. We're looking for a CBO organization that has existing relationships with FFN caregivers serving children birth to 5. Those relationships can be centered around any connection point. So that might be child development services, nutrition and food resources, housing resources, immigration resources, or other resources serving the FFN community. We're looking for an implementation partner who has the ability to embed Thriving Providers Project as an additional service alongside other services or to support FFN communities. We are looking for a partner who can perform the planning and implementation scope functions, and we'll describe that in detail later. And we are looking for a partner who will be willing to agree to the stated project values. On this next slide, you'll see the project values. And these are essential to really both the decision-making process and the local program design process of the Thriving Providers Project. So at the center really is that we value caregivers and communities. Their opinions and the work that they do are essential to the project, and we believe they should be adequately compensated for the work. We trust caregivers to make decisions for themselves, and we seek to give them power and agency to do so. We affirm their assets and strengths, and we make space to elevate the voice of participants in decision-making. We trust in caregiver and parent reports on the well-being of themselves and their children. Also, a commitment to equity. We want to ensure that the project design both acknowledges the complicated and discriminatory history of early care and education and the ways that it has disenfranchised and marginalized communities. And we want to utilize the Thriving Providers Project to begin to right some of those inequities. We want to leverage guaranteed income best practices. So there's a lot that's known about guaranteed income and direct cash. And so we are using the evidence base that exists within the guaranteed income space to structure Thriving Providers Project pilots. We seek to mitigate unintended negative consequences wherever possible. So a lot of the design process focuses on what are the unintended negative consequences that we need to plan around. How do we ensure that we are accounting for those? We are developing strategies that will overcome them and or protect participants from harm. This is an iterative process, so we are learning by doing. We certainly have a set of resources and a set of learnings that have emerged from our work in Colorado, but we recognize that implementation of TPP in every community will look a little different. And so we engage in an ongoing process of testing, learning, and iterating to ensure that implementation is appropriate and relevant for each community and that the outcomes realized are the best possible outcomes. And then our learnings and resources are open source. They're intended to be freely available to practitioners, funders, providers, and policymakers. All right, so now we're going to just transition into the scope itself and talk in detail about what the scope would entail for the selected partner. So there are really 2 phases of the project: the planning phase, which we talked in great detail about, and then the implementation phase, which is really marked by the delivery, the beginning of delivery of cash to participants. And so starting with the planning phase, really there are several products that the implementation partner will be expected to either produce or to produce in collaboration with other key partners. And those products include a project management timeline with tasks assigned to key decision makers, a set of eligibility criterion, and an enrollment application designed in the payment platform Beam, an implementation budget, which includes local considerations, a benefits counseling approach, a recruitment approach to identify participants to um, uh, participate in the pilot. And then finally, a project design document informing adoption of the TPP theory of impact and evaluation plan locally. Um, Again, these products are developed in part and informed via the community design process and will be guided with the support of homegrown consultants and the TPP project team, who will share resources and other materials needed to support execution. Also a part of the planning phase, it will be a policy landscape assessment. The LA implementation partner will contribute to the development of that landscape assessment process, but that process will be led by First 5 LA. All right, next slide. So the community-based organization activities associated with the design process in the planning phase include collaboration with homegrown staff members, First 5 LA, the payment distribution platform vendor, and research partners. So again, engaging with all those stakeholders to make decisions for the local implementation, document those decisions, and complete the planning phase work products. Convening stakeholders, beneficiaries, and representatives from similar initiatives and facilitated discussions around project design. Meeting with homegrown staff and consultants. We estimate that that is usually between 4 to 6 hours monthly, but some of that depends on the actual planning team structure and how implementation communities decide to structure their project team. Reviewing materials in preparation for monthly meetings and completing key project tasks following monthly meetings. And then finally, sharing data and insight and experiences to support planning and design goals with homegrown and First 5 LA. So we're expecting that the implementation partner would bring their local context knowledge into this process to ensure that the pilot design is really responsive to the local context. All right, next slide. In terms of what this looks like as it relates to staffing, our estimation is that the implementation partner will likely need to allocate one full-time equivalent employee to serve as the project manager. And then the project manager will be responsible for completing the key planning and implementation phase activities, overseeing day-to-day implementation of the project. In some cases, the implementation partner may consider adding or dedicating an additional 2 to 3 part-time consultants, subcontracted vendors, or staff during the implementation phase to meet the scope requirements, depending on the organization's existing areas of expertise and organizational capacity. But the scope of work for subcontracted vendors would need to be approved prior by homegrown and First 5 LA. All right, so we'll transition now into what it looks like, the scope of work, what it looks like in the implementation phase. During the implementation phase, the CBO partner assists with co-convening or convening stakeholders, beneficiaries, and representatives. So that process really weaves all the way through the project to ensure that there are community inputs all the way throughout the project. The regular monthly meetings with homegrown staff and consultants moves down to about 1 to 2 hours a month, just to update on implementation phase activities. During the implementation phase, this is when participants are recruited, screened for eligibility, that they receive benefits counseling, and then are enrolled in the cohort. And then throughout the project, the implementation phase, the partner would liaise with the payment platform vendor to ensure timely execution of monthly payment and troubleshoot any user payment issues. The implementation partner also holds the relationship with pilot participants. So homegrown really will entrust the relationship with TPP participants to that local implementation partner. We know that that partner will likely come to the table with existing relationships. Many of these participants may already be known to the CBO partner, and the context knowledge really lives in community. And so the relationship holder with TPP participants will be the implementation CBO. That the implementation CBO will triage any questions from participants about the project itself, be able to answer questions about the project, its partners, the evaluation plan. The implementation CBO will liaise with research partners, as well as support and lead the communication and policy strategy for TPP. And use TPP data to influence key policymakers, as well as design communication strategies for key audiences. The implementation CBO will design and implement an exit strategy really designed to support pilot participants in preparation for the pilot end. And then the implementation CBO will regularly share data, insight, and experiences to support the project team in meeting its design goals. So now I'm going to hand it over to Claire, who will talk us a little bit through the additional qualifications and then how to submit a proposal.
Great, thanks, Alexandra. Okay, as Alexandra said, I'm going to walk through the nuts and bolts of the proposal process, including some important requirements and each of the 8 questions. And this content that I'm covering is found on pages 7 through 9 of the RFP document. First, proposals are due by 3 p.m. Eastern or 12 noon in California on Tuesday, July 9th, 2024. You'll be submitting the proposals as a single PDF attachment sent to info@homegrownchildcare.org. And in that single PDF, responses to questions 1 through 7 should take no more than 10 pages. The documents that we request in question 8 do not count towards the 10-page limit. Now, to help us navigate the proposal documents, we're requesting that you please include the headings that you see underlined in each of the application questions. And most importantly, please provide clear examples throughout your responses to make your organization's capacity and values alignment evident. Okay, so I'm moving into the 8 proposal questions. And before I continue, my intent here is to share a little more about the spirit versus the letter of each question, so I won't necessarily cover all of the details or sub-bullets. And the first question isn't really a question, it's the cover letter. And this should include basic information about the applicant organization and the primary contact person. Now, the second question focuses on describing the applicant organization to provide a little more history and context. And again, we're asking that you include the underlined heading. So in this case, it would be organization description and structure in the proposal document. Now with number 3, we're really trying to understand your organization's connection to family, friend, and neighbor caregivers and the FFN community as a whole. So in your response, please share what you have learned about their strengths, needs, and demographics. Now, as Alexandra described earlier, a core strategy of TPP is that the direct cash is additive in nature and comes alongside other available resources and support. So in question number 4, we're looking to learn more about how your organization envisions the TPP direct cash pilot being embedded in your existing supports to FFN providers. In your response, please share any details from your organization's perspective that you think are important about delivering the cash support. I'd really like to emphasize the last and certainly not least bullet point here around provider voice and leadership. This is a critical aspect of TPP, so please be sure to articulate the ways in which your organization will address this in the LA County implementation. With question number 5, we're hoping to understand anticipated implementation challenges or capacity needs. Please consider reviewing the content in Appendix D in the RFP and point to specific resources in your response that your organization might find helpful. Question number 6 is about anticipated funding sources. As Alexandra mentioned earlier, funding for this project is secured, including the generous co-funding from First 5 LA to support the planning process and cash for participants. Applicants will not be eliminated based on the response to this question, but we are curious about potential for additional funding. If available, additional funding sources could be used, for example, to expand the services provided alongside the direct cash transfer, or to expand the cohort size of providers enrolled in TPP. Question number 7 asks for FFN provider referrals. Responses to this question will only be followed up on if your proposal is selected to move forward into the interview phase. Please obtain consent prior to listing any providers in your response, and be sure to include their language of preference. And finally, number 8, the documents requested here, an org chart and operating budget, do not count towards the 10-page limit, although they should be included in the single PDF file. And that's the last aspect of the proposal. Again, these responses are due by noon California time on July 9th. So before we move into the Q&A portion of today's session, I wanted to reinforce that responses to the RFP will be evaluated for both evidence of organizational capacity and values alignment. This is why it's important to include those concrete examples from your organization's past work that can illustrate the skills and infrastructure needed to operationalize the values and agreements in Section 3 and the scope of work in Section 4 of the RFP. All right. It is time for some Q&A. I've been trying to keep an eye. I don't see any questions yet. So everyone, please do feel free to add any questions, background of the program, or aspects of the application itself into the chat, and we're happy to respond to them. Alexandra, while we're waiting for some questions, do you have anything that has occurred to you since I took over?
No, but I think we did. I think we do have a question in the chat. So, I think if you want to read that one out.
Sure. So the first question, there's 2 so far. Do we know how large the FFN cohort will be? And so both questions so far are the same.
Yeah, so Manpreet, I think and I hope I'm saying your name correctly. What we'll do is we'll include the answer to that in our FAQ. What we can share with you is the number of participants that are currently funded with this cohort, but I think to Claire's description of the proposal questions, one of the things that there's an opportunity for is potential additional funding for additional participants. So we will be including any questions we receive to the Homegrown inbox, and any questions that we receive today in an FAQ on the Thriving Providers Project website. So look for the answer to that in the FAQ. I don't want to misspeak about the number, so I will make sure that that gets into the FAQ.
Okay, we have a clarifying question from Eliana and regarding, whether this is only for LA County.
Yes, this is an LA County cohort. Any other questions?
Sorry. Hi, this is Rachel. Can we ask questions out loud or only in the chat?
No, that's fine. We weren't sure how many folks were going to join us today, but Rachel, I think we're small enough that we can happily receive questions via audio.
Wonderful. I wasn't sure that I would be able to get the full type in before we moved on. So good morning and thank you for having us and for hosting us. My question is, my agency, we know that we touch FFNs and caregivers in our work, that we don't have programs exclusively designed for caregivers, but we have a wealth of experience in administering GI programs. And so we're wondering how we should think about our opportunity as an applicant to this RFP, since we don't have FFN specific programming. Would you say we are eligible or not? I know that's a tough thing to answer, but just so it can help us guide our decision making.
Sure. So I don't know that we could really speak to your eligibility without reviewing a full proposal, but what I will say is that we are looking for organizations that and are open to receiving proposals from organizations that have a range of touch points with FFN, the FFN community. So I think being able to speak to experience delivering direct cash to FFN in past can be described in a proposal as experience with the FFN community. I do think you'll want to think about what opportunities for strategic partnership or vendors might be necessary in order to realize the additive nature of the theory of impact. And that might be something you speak to as it relates to one of the challenges that you anticipate with implementation. So, as I shared, we're open to receiving proposals from organizations, not just those who might be delivering child development services or early childhood services, but, who might have other touch points with FFN caregivers. Oftentimes, FFN caregivers do not think of themselves as early childhood providers. And so we recognize that we need to receive a breadth of proposals to really ensure that we are able to capture some of those folks who may not be connected already to early childhood systems. And so we would say, speak to your strengths and what you do know and what you have existing capacity around. And then in that question where you are identifying either strategic partners or places where you would want some of that project support to build capacity, to outline where you see there might be some need based on your organization's prior history.
Great, thank you.
I'm just going to give a long pause because I want to make sure nobody else feels like they have to rush their question. You-
Pero
you-
como arrancan los niños, ¿eh? Me fijo en el niño, que ella también, nomás se ve.
Yolanda, oh, okay. Yolanda, did you have a question?
Oh, está muy bien.
Okay. I'm going to assume that's a no. All right. Any final questions before we move?
No,
Okay, great. Thank you.
Just before we move on, feel free to add more questions as they occur to you in the chat. We'll be, again, posting responses to frequently asked questions on the website. There's also, well, we'll get to that. So please feel free to keep using the chat box.
You're welcome to jump ahead, Claire. It's fine.
No, that's fine. You ready to continue?
Yes, let's go ahead
Okay.
to the RFP timeline. Great. So this is in your proposal document, and we'll just run through this really quickly. The RFP was released on June 4th. We're having the information session today. You have until June 17th to submit questions, and that's June 17th at 3 p.m. Eastern. We'll have the email address for where to submit those questions on the next slide. And then the RFP submission deadline is July 9th by 3 p.m. Eastern. We plan to conduct virtual interviews by invitation only during the week of July 22nd through the 26th. And then our intention is to notify the selected proposal the week of August 9th, with an intention to begin a contract in September. And so, thank you, Claire. Any questions that you all have as you're reviewing the proposal or preparing your proposal, you can submit to info@homegrownchildcare.org. All of the responses from the few questions we received today and any that are received by email will be included in an FAQ document that we will post to the Thriving Providers Project website. And again, those questions are due no later than June 17th at 3 p.m. Eastern. And then you'll see the website address if you need to go back and reference any project details or the RFP document itself. All of that can be found on the project website. I think that's the extent of the content. I want to just pause and see if we have any final questions. Well, okay. That's the case. We will end 9 minutes early, which seems to be unbelievable given we had a few technical hiccups at the start, but we're grateful to you all for joining us today. And again, if you have any questions that you think of after our convening, please feel free to email info@homegrownchildcare.org by June 17th. Thank you, everybody, and have a good afternoon.